Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Today we will discuss the World Malaria Day, and the theme of the World Malaria Day of this year means 2020 was harnessing innovation and reducing burden and saving lives. I am Professor Hussein Bolachi, Chairperson of Community Medicine, ISRA University, and I am also Fellow of College of Surgeon of Pakistan and the former Dean of Liaquat University and former Dean of IsraUniversity, but presently I am Professor and Chairperson of Department of Community Medicine. Since 2014, ISRA University is celebrating different international days, including World Malaria Day. And once again, the theme is harnessing innovation. So we are just bringing this information on my YouTube channel, Dr. Hussein Bolaji, and you will get the new information and updated information. And please share this, like this, and up to the end. I think if you will continue with our presentation and YouTube channel, it will give you a lot of information, new information about the vaccine and other things. So World Malaria Day is important and celebrated on 25th April, almost in the global level, and WHO, United Nations, and the governments are interested, particularly the public health issues are discussed. And malaria is one of the historical disease which has changed not only the public health, but also the course of history of mankind also. So without wasting time, the first slide is the mosquito is the main vector of malaria, and Anopheles female mosquito is the vector or is the insect which bites into the skin, and then the parasite we called it plasmodium uh, parasites, and they are of the four types we will discuss there, and they are injected into the blood, they go to the liver, and then there are certain changes we call it this malaria cycle, and then after liver, once again these parasites enter into the blood and burst in the RBCs, where the symptoms of the malaria, clinical malaria starts, fever, rigors, and shivering, and other symptoms of weaknesses, and even mental confusion, and we call it the brain symptoms or encephalitis-like symptoms, particularly in Plasmodium falciparum. These symptoms are very common. This map is showing you the malaria prevalence, and before 19th century, the 70% of the world was affected by the malaria, but now the purple color is showing that presently these countries are facing a heavy burden of the malaria. Rest of the countries, either they have controlled malaria or they are malaria free. And the Pakistan is also in the purple area. If you see this map of the world, this is the gate of the famous hospital called Fever Hospital in Sikandarabad in the subcontinent, and where the malaria experiment was conducted by Dr. Ronald Ross in August 1897, where he dissected the Anopheles mosquito, which uh, had bitten the patient admitted in this hospital, and the mosquito and the patient both showed the parasites of the malaria, and this was proof that the Anopheles female mosquito is the main vector or the reasons or the cause of the malaria. And this discovery was shared by Ronald Ross, and ultimately he got in 1902 the Nobel prize in medicine and physiology both, and this discovery laid the better understanding, and the new vistas were open to deal with the malaria. So this is still important milestone, and Sikandarabad is shown in the, it is in Telangana and it is in Hyderabad. Dakhan nowadays it is called Bharat or India. Uh, this is the stone or the tablet erected in 1935 in the memory and the good work of the Ronald Ross. And you can see that in the memory of great man word is used, and the discovery of the malaria exact date is mentioned at 25th August 1897. The late Sir Ronald Ross, a benefactor of mankind, made the great discovery of the parasite of malaria in a dissected Anopheles mosquito. And you can see that this is the picture of Ronald Ross, and side by the mosquito picture is there. And the Nobel Prize was awarded to him, and I think that is the great these are the few facts. This showed that in 2020, 241 million cases of malaria were reported, and in the previous years, 227. It means that about mm, uh, 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 from 227 to 241 means almost a great number of the cases are about 20 million cases were higher than the previous year, means 2020. The same is that the deaths were also 69% more than the previous years. And this was because the COVID pandemic affected in the late 19 and in the 20th, the whole attention of the medical system remained towards the dealing with the COVID and malaria and other strategies, programs, preventive measures. They were not. Then this shows the map of malaria, uh, and that also shows that Pakistan is almost in a red color. Uh, uh, then the four parasites, Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Malaria, and Knowlesi, these are the four parasites which are basically transferred from the mosquito to the human blood, and then once again the bite of the mosquito as a meal is taken, the cycle of the parasite starts, and there are many stages and many forms which are better discussed in microbiology and pathology labs. These are the drugs. The first drug was quinine, and quinine you can see, and the last is nowadays then is the chloroquine, and ACT is the RT-Sunurate and RT-Mithicine and other drugs. They are nowadays used in combination. Uh, this is the new development of the vaccine, and the name of the vaccine, which has been approved in the last October 2020, just 6-7 months ago. The Mass Querex is the name, and the GSK company has been in the front line of developing this vaccine, and the RTS S is the name given to this vaccine also. It is used in Africa, and so far 800 children have been administered this vaccine, and the 2.3 million doses are there in pipeline. And WHO has approved this vaccine for wider use because Africa is uh, having almost 95 to 97% of the global burden of the malaria. This vaccine is of 4 doses uh, vaccine, and they are now given from 5 months to 18 years of age. The prevention is important. The first is the vector control, uh, which is through the bed nets or ITNs and IRS or spray. But the problem is that with the spray, the resistance is going more and more. Almost 29 countries are resistant with main insecticide classes, which are 4, including DDT, but 78 countries are also showing resistance to this. So we are left with the bed nets, we call it insecticide treated nets. They are long lasting ILLN. Then the vaccine is there, treatment is there, and WHO Technical Strategy 2016-30 envisages that 90% cases be uh, reduced, 90% mortality be reduced, and from 35 countries, at least the malaria should be eradicated. These are the few pictures you can see. These are the African children mostly affected by the malaria. This is the Ronald Ross laboratory view, which is present in the archives, scientific archives. Uh, so this shows that how the malaria is this vaccine is basically, you can see that the malaria vaccine and its wider use has started in the whole Africa, where the malaria is one of the killer disease more than the COVID also. WHO has promised that the supply will be there. This is Oxford University, where also the vaccine is under preparation, and the third trial has started in Burkina Faso. This vaccine will also be available. And then the third, BioNTech, Dr. Ugar and Dr. Sahin, they are also in the forefront who developed the first Pfizer vaccine for the COVID on the mRNA technology. They are also announcing that their company or their laboratory will also be. This is important because the mosquito repellent plants are there, particularly the neem tree is very common in Pakistan, amaltas is very common, and other trees are there. Citronella is very important tree which repels, but the neem tree can repel almost 500 insects. This shows that the astronaut from China, they are landing on the earth, but still we are facing the malaria. So the science at one level, it is touching the space, but on the other side, we are unable to deal with the mosquito. This is the bed net, which is prepared for the bride and bridegrooms. And even in the history, the Cleopatra, the medieval queen of Egypt also used the mosquito. So with this, I think Dr. Sen YouTube channel is ending. this presentation of the World Malaria Day. I hope you have learned something updated. There are reported 500,000, not but 500,000 cases of malaria. And in the province of Sindh, it is also a high burden. About 1 lakh cases are reported this year. So these preventive measures, use of bed nets, IRS or insecticide sprays, and plantation of the mosquito repellent trees, awareness, behavioral change, and the ISRA University Vice Chancellor announced in the World Health Day Malaria program that a research and training center will be established in the IsraUniversity with the help of the WHO, Director General Health, and the IsraUniversity. The program and this presentation was actually presented in the World Malaria Day webinar yesterday, chaired by the Vice Chancellor, Professor Nazir Ashraf Lagari. We are thankful that he spared the time. The other experts, one was Dr. Ramesh Kumar from Bangkok, Dr. Salma Kundi, President Center, Pakistan Medical Association from Peshawar, and WHO, Dr. Haris and Dr. Anam. We are thankful to the WHO officer, Dr. Sarah Salman and Dr. Badr Munir for their cooperation, and DHO Hyderabad, Dr. Lala Jafar also shared and emphasized on the preventive measures, and Professor Abdul Sattar Mohammed, the Chief Executive Director of Academics, also spoke in the program. With this, we are ending the World Malaria Day presentation once again. For new and updated information, subscribe Dr. Hussain Baksh Kolachi YouTube channel. I will urge the students, faculty, alumni, staff of the ISRA University to spread the message and awareness of the World Malaria or Malaria Day or a preventive measures malaria, which we have discussed, to the larger community, not in Pakistan, but outside Pakistan, where they are. Thank you very much.